Hey everyone, it's Tony, and today I'll be talking to you about thrombophlebitis. So basically, what is thrombophlebitis? It is a blood clot that is formed by the inflammatory process and causes a blood clot to form in one or more veins. It is usually seen in the legs, but it can affect any part of the body. And there are two types mainly seen. There's a superficial thrombophlebitis, and there's also deep, which will be mainly be seen with that deep vein thrombosis. So, how does a person get this condition? A lot of times you'll see it with that trauma if they've recently had surgery or prolonged inactivity. And some risk factors that may be seen are listed below, such as inactivity, varicose veins, a pacemaker or catheter connected to a central vein, if they are pregnant, if they're on birth control or hormonal replacements, if there's a family history of these conditions, or if the patient has had a stroke, if they're over 60, obese, smoke, or have cancer. So, how does it affect a person? If it is a superficial thrombophlebitis, they will see that warmth, tenderness, and pain over the area that is affected, and they may also present with that firm and tender cord seen on the right picture. If they have a DVT, this can present with pain, swelling, erythema, which is redness of the skin. And basically, we just need to look out for that Wells criteria that we learned last semester. So prevalence was kind of hard to find, but prevalence of an inherited thrombotic syndrome is around 1 in 2,500 to 5,000. This can increase with a past history of deep vein thrombosis. Um, Women are slightly more affected due to the systemic estrogen use, and elderly patients are more at risk, seen around that 66-year-old range. So medications that can be taken if they have a superficial thrombophlebitis, they can apply heat, elevate their leg, and take an over-the-counter non-steroidal anti-inflammatory drug such as an NSAID. For both superficial and deep, they can either take a blood thinning medication, which can be that Arextra or that Xarelto, or they can also take that blood clot dissolving medication, such as Activase. There are some other options they can do to try to limit this. They can do their compression stocking. They can have a filter surgically implanted somewhere like the vena cava just to prevent blood clots from transferring around the body. Or they can have varicose vein stripping where a surgeon will actually go in and remove those varicose veins to reduce that risk. So my first study kind of looked at facial vein thrombophlebitis. Um, Basically, it was a case report involving a 10-year-old that had preseptal cellulitis caused by sinusitis, which is that paraorbital swelling complicated sinusitis, which that swelling and erythema will grow beyond that orbital region. And basically, they just looked at different diagnosing techniques, showing that the contrast enhanced CT scan is mainly used, but MRIs may also be used, and basically just showing that professionals need to be aware of this possibly happening in children because that cellulitis is common, but we also want to make sure that this uncommon condition doesn't progress into that facial vein thrombophlebitis, which is the uncommon condition. My second study was a randomized controlled trial of dalteparin and just comparing its effects and safety to ibuprofen in the treatment of superficial thrombophlebitis. Basically, they just looked at 72 different patients and either gave them ibuprofen or dalteparin 3 times a day for 14 days. Um, Both reduced pain pretty equally, but 4 patients with ibuprofen showed the thrombus extension, while 0 patients with dalteparin presented with the extension, and basically just showing that the dalteparin can be an effective medication for this condition. So, kind of relating it to our top 20, the main problem will arise when that blood clot dislodges and becomes an emboli. This can lead to a stroke, a pulmonary emboli, or even a heart attack. And conditions such as DVT should be treated as a medical emergency, and early diagnosis and treatment can be largely beneficial to the patient. Well, here are my references. Thank you for listening. And if you have any questions, please leave a comment below, and I will gladly answer them as soon as I can. Thank you.